They don't call it the Queen City for nothing. Next story takes us to the South, where one woman is showing how she is redefining her power and her passion post-menopause. Veronica De La Cruz is there with the story.
Hey there, Dr. Drew. We're here in Charlotte, North Carolina, otherwise known as Queen City, which is fitting because you're about to meet a queen who says that she feels like she's fallen off her throne. She's a wife, mother, and soon-to-be grandmother. But behind that smile was years of silent suffering. After a hysterectomy in her 30s, sex became painful.
I felt worse than a queen off her throne because not only was it impacting him, it was impacting me in a way that probably showed up for even other areas of my life. I felt broken. I think is the best way that I can describe it. I really felt broken as a woman, and nobody was able to help me put things back together again.
Tanika was suffering a specific disorder called genitourinary syndrome of menopause, and her main specific symptom was painful sex. So the great news about painful sex is there's so many things that we can do to treat this.
Now Tanika takes Invexie a couple times a week. It's a tiny capsule of low-dose estrogen.
It's small and tiny and convenient, so a lot of women really like it, and it works. I personally see about 4 cases of painful sex every day, so to me, it feels like an epidemic. We have this treatment, it's a great treatment. We just have to get it to more women.
I feel like I got my life back. I feel like I got old Tanika back. And I know for him, he probably feels like he got his wife back. I feel like a queen who has found her throne again.
Here with me now is Dr. Alyse Kelly-Jones. Thank you so much for joining us. This is a big topic. I feel very passionately about it. I can't believe how women have been sort of marginalized for these medical problems.
Right, and it's the marginalization of women that I actually talk about in my office every day. It's like we're over here, and we've been over here for so long, but I actually think we're moving more towards the center over the last few years.
I would agree with you. We're sort of not as physicians, we're not in denial anymore. We're not telling women they're crazy, they're depressed, when they have perimenopause and menopausal symptoms, which are profound.
Right, exactly.
Profound. We saw just in your tape, a marriage nearly got destroyed by something that's easily treated.
Right, and we get married to be connected to somebody, right? And we have sex to be connected to somebody.
What?
And when that all goes away, then that's a big problem for the relationship.
Historically, what primary care doctors would do, oh, you're feeling depressed, or you're not sleeping right, you're disconnected from your husband. Here's an SSRI, which shuts their libido down in addition to their menopausal symptoms.
Right.
Terrible.
Unfortunately, orgasms go away with SSRIs on many, many people, not just women.
Yeah, men too, that's right.
Right.
So tell me about your product.
So our product is called Invexie, and it is a local vaginal estrogen. So not all through the whole body, it's only in the vagina. And it's indicated to treat moderate to severe dyspareunia or painful intercourse in women who are candidates.
And how is this different than estrogen suppositories or creams, things that are out there?
So there's quite a number of products that treat genitourinary syndrome of menopause. This is one of them. It's a little tiny capsule that a woman places every day for 2 weeks and then twice a week. So nice, convenient. It's an oil-based product. It doesn't have an applicator. She just inserts it with her finger.
Less mess.
Less mess, and it's tiny, so it can go anywhere.
And then as far as systemic replacement, which is, again, there are a lot of ways to do that.
Right.
There's pellets and pills and creams and all kinds of stuff. Not everything is for everybody. Some women go through perimenopause and menopause, no problem. This is not for them. Right. This is the women who in perimenopause are being told they're depressed, they're crazy, they're just stressed out by child rearing. Oh my God, we just do so many horrible things to women. It's so egregious.
Right.
If you're 35 or above and you just don't feel right, talk to somebody like this, please. Tell us one more time about the product, the name, where they can get it.
So it's called Invexie. They would get it from their healthcare provider. It is a prescription only, and it's used vaginally to treat moderate to severe dyspareunia, painful intercourse related to being in menopause.
Great. Thank you so much for
You're
being
welcome.
here. Appreciate
Thank you for
it. Good
having
work.
me.
If you want more information, as we heard, go to Imvexxy.com. That is spelled IMVEXXY. Next up, we're talking about something that hits close to home for me. You're watching Health Uncensored. Be right back.
Important safety information. Warning: endometrial cancer, cardiovascular disorders, probable dementia, and breast cancer. See full prescribing information for complete boxed warning. Estrogen alone therapy. There is an increased risk of endometrial cancer in a woman with a uterus who uses unopposed estrogens. The Women's Health Initiative, WHI, estrogen alone substudy reported increased risks of stroke and deep vein thrombosis, DVT. The WHI memory study, WHAMS, estrogen alone ancillary study of WHI reported an increased risk of probable dementia in post-menopausal women 65 years of age and older. Do not use estrogen alone therapy for the prevention of cardiovascular disease or dementia. Estrogen plus progestin therapy. The WHI estrogen plus progestin substudy reported increased risks of stroke, DVT, pulmonary embolism, PE, and myocardial infarction, MI. The WHI estrogen plus progestin substudy reported increased risks of invasive breast cancer. The WHIMS estrogen plus progestin ancillary study of WHI reported an increased risk of probable dementia in postmenopausal women 65 years of age and older. Do not use estrogen plus progestogen therapy for the prevention of cardiovascular disease or dementia. Contraindications: Imvexie, estradiol vaginal inserts, is contraindicated in women with any of the following conditions: undiagnosed abnormal genital bleeding, known, suspected, or history of breast cancer, known or suspected estrogen-dependent neoplasia, active DVT, PE, or history of these conditions, active arterial thromboembolic disease, for example stroke, MI, or a history of these conditions, known anaphylactic reaction, angioedema, or hypersensitivity to Imvexie, known liver impairment or disease, known protein C, protein S, or antithrombin deficiency, or other known thrombophilic disorders. Warning and precautions: risks from systemic absorption. Imvexie is intended only for vaginal administration. Systemic absorption may occur with the use of Imvexie. Cardiovascular disorders, malignant neoplasms, and probable dementia. Please refer to boxed warning for endometrial cancer, cardiovascular disorders, probable dementia, and breast cancer. The use of estrogen alone and estrogen plus progestin therapy has been reported to result in an increase in abnormal mammograms, requiring further evaluation. The WHI estrogen plus progestin substudy reported a statistically non-significant increased risk of ovarian cancer. A meta-analysis of 17 prospective and 35 retrospective epidemiology studies found that women who used hormonal therapy for menopausal symptoms had an increased risk for ovarian cancer. The exact duration of hormone therapy use associated with an increased risk of ovarian cancer, however, is unknown. Other warnings include gallbladder disease, severe hypercalcemia, loss of vision, elevated blood pressure, severe hypertriglyceridemia, cholestatic jaundice, fluid retention, and hypocalcemia in women with hypoparathyroidism. Estrogen therapy may exacerbate hypothyroidism, endometriosis, hereditary angioedema, asthma, diabetes mellitus, epilepsy, migraine, porphyria, systemic lupus erythematosus, and hepatic hemangiomas, and should be used with caution in women with these conditions. Women on thyroid replacement therapy should have their thyroid function monitored. Adverse reactions. The most common adverse reaction with Imvexie, greater than or equal to 3%, was headache. Indication: Imvexie, estradiol vaginal inserts, is an estrogen indicated for the treatment of moderate to severe dyspareunia, a symptom of vulvar and vaginal atrophy due to menopause. Please note that this information is not comprehensive.